This is the corridor in the A&E department at the Royal Bolton Hospital. On every single one of these trolleys is a patient.
And it's not something we want to do, but we've only got a finite amount of space within the department. It shouldn't happen, but what we've got to do is utilise all of the space within the emergency department to prioritise the cases that most need the appropriate care. And we have a time limit as well on the amount of time patients will be on a corridor.
What is that limit?
So we aim for no more than an hour of having a patient on a corridor, and as I say, those will be the more stable patients who are moving off to a ward, and it's where a bed is about to become available.
But beds on wards are in short supply. This screen shows what is available and what isn't.
So for example, here at the moment we have no beds on our medical assessment unit, there's no beds available on the wider wards, but we do have 9 definite discharges coming up.
It's graded like traffic lights, but black shows the worst it can be. So that's the children's ward?
Those are the children's
wards. So that black status, what does that mean?
So at the moment there are no beds on our children's ward, but our consultants and our nursing teams will be out on the ward now looking at how they can discharge patients safely.
And it does change throughout the day as beds are freed up.
A bit like a big jigsaw puzzle, moving patients around to get everyone in the right place and the bed that they need to be into, or back home.
The hospital is very keen to stress it would never turn a child away or any patient. It also says higher attendances are expected because some winter pressures have come early.
Nearly every element of the system and all of our system partners to a certain extent are currently feeling extreme pressures. We have issues within social care, so we have patients stuck in hospital we can't discharge. And then we're seeing a lot of really unwell patients who may not have had access to healthcare over the last 3 years. On the backdrop of all of this, we're seeing now recently quite a big surge in flu cases.
There's also a big after effect of COVID.
Here in Bolton, we've got 39,000 people on a waiting list waiting to come in for treatment or investigations or an operation. That didn't exist before COVID, and that puts additional pressure on the hospital more broadly.
What we saw at the Royal Bolton Hospital was staff working hard to make sure people are seen when they need it the most.
I'll sit here as long as it takes, because they're all fantastic.
But while they are looking after us, who's looking after them?
We have a raft of stuff for our staff in terms of well-being. We've asked so much from staff throughout the pandemic, and we continue to do that. And it's just important to get that message out to them, to just say thank you, really.
It's no secret the NHS is under massive strain, with hospitals everywhere feeling the pressure. Strikes are looming too, and we are almost into winter. The message from A&E though is as long as patients need their help, they will continue to provide it.
The public also need to think twice before they come to emergency departments and think about where their care can best be delivered. We will see everybody, but those patients who don't necessarily need to access our department may unfortunately wait much longer than either us or they want to.
Claire Hannah, ITV News, Bolton.